Good morning, everybody, and welcome to this webinar. Just to let you know, we're going to start in about 5 minutes, just to allow more people to attend, to join. Thank you.
Did you actually
Good morning, everyone. I think everyone else might be here by now. Morning. Yeah, morning, colleagues from Limpopo, from Bumalanga, and everywhere who are joining us. And of course, good morning to the colleagues here at SAHPRA.
My name is Colbert. I am going to do the opening and the welcoming for the webinar. The webinar is on the radiation control regulatory compliance, and we'll have two speakers for this webinar, Mr. Mahlangu and Mr. Mapope, going to present the topics on inspections and the licensing process for X-ray, respectively. Welcome once again. We welcome you to this webinar and we thank you for your attendance. And just to give you a small brief, are you sharing something, Mr. Mapope? Oh, thank you. Thank you very much. Yeah, just to give you a small brief. So this webinar will cover the compliance related to the radiation control within SAHPRA. Thank you very much. And yeah, the first topic will be on compliance requirements by Mr. Mapope. And the second presentation will be on inspections and enforcement by Mr. Phineas Mahlangu. I'm officially opening the webinar and handing over to our first speaker of the day, Mr. Mapope. Over to you.
Thank you, Mr. Ditsepu, and good morning, colleagues. Good morning, everybody. As Mr. Ditsepu said, my name is Mfundisi Mapope, and I am the Deputy Manager responsible for the licensing of electronic generators of ionizing radiation here at SAHPRA in RadCon. Just a few things. The colleagues, we are requesting that you keep your mics on mute. And while the presentations are happening, you can have your questions on the chat. And then after the two presentations, then we'll have an hour or so of discussions where we can interact. You can ask questions, and we will discuss those questions. So that time we allocated it an hour for those questions, but some of the questions we can answer while we are presenting if you drop them on the chats. So yeah, and then yeah, we please because the session is also recorded, we request that everybody keeps their mics on mute. Right. So I'm gonna start the presentation just to give you guys an understanding of the requirements at radiation control when it comes to licensing of X-ray equipment. Please confirm if you can see my screen.
Yes, we can, sir.
Yes, it's visible.
Thank you. So just to give you a background in terms of radiation control as a unit at SAHPRA, radiation control have 4 subunits on its own, and those subunits include X-ray licensing, non-ionizing radiation medical devices, and then also radionuclides, then inspectorate. So those are the 4 subunits under radiation control, but radiation control falls under a program called, we call it Program 5, that combines medical devices and radiation control. So obviously the work that we do as radiation control is a work of formed from legal basis, and the legislation or the legal framework that we use, it comes from the Hazardous Substances Act and its related regulations. So if you want to see the Act, they are available on the website. So the SAHPRA website, even for other programs, all the acts, you will find them there. But for radiation control specifically, you can find them under the radiation control operational unit. So the regulations that we use for the control of X-rays, it's regulation R1332. So usually when you have an act, that's what the government will approve, or the president will approve, and then the minister will approve the regulations. So, and then for us is to administer those regulations, those acts and regulations as a regulator. So for Group 3 hazardous substances, which is you guys, we know it as electronic generators of ionizing radiation, we use 1332. And then for Group 4, which is radionuclides, we use R246 and R247. Then you find the regulation 1302, that is giving you all the listed electronic products that's supposed to be regulated under 1332. So all this information is available, and it's good for anyone that works in the space to familiarize themselves with those things, because it affects how it affects our relationship from regulator to the industry, because we need to interpret those regulations in a more common ways. So we can't interpret it in one way and you guys interpret it in another way. So it's important for you guys also to read. That's why the documents are available for you guys to understand what is on the regulation. So for this presentation, I just extracted a few things from the Act and the regulation, so that we just highlight a few things. When you go to the Hazardous Substances Act, Section 3B, it tells you that no person shall sell, let, use, operate, or apply any Group 3 hazardous substance unless a license is issued under Section 4B. So this is where we come in. We're making sure that these activities doesn't happen, and it can only happen when we issue you the correct license to do any of those things. And then Section 3C talks about the installation or keep installed. Again, you guys, we issue a may install or a may not install, and it's because the Act is giving us those that mandate to do so. So when we issue a license to use an X-ray machine, we normally say use and keep installed. So meaning if there's anything else and you want to remove the machine or anything, then we need to be notified, because as far as we know, the machine must be kept in your premises, and you are licensed to keep it and use it. So should you not have it, that's where this came from, that we need to then receive the application to do so. So what you find on regulation 1332.
Just a second, Mr. Mokope. If we may remind the colleagues that they please switch off their mics.
Thank you, Mr. Tsepo. Okay. So what you find in regulation 1332, you find that it then gives the regulator powers to issue licenses issue conditions of those licenses. So you'll notice some of the prescribed condition on the regulation. I mean, it's just an indication, but it gives the regulator the powers to actually create those regulations, those conditions, I mean. And then the regulation also allows the registration of radiation workers. So we'll try to touch on all of this with the time we have, and see if we all understand it the same way. Okay. So zooming deep into the regulation, one of my favorite section of the regulation. So now we move from the Act to the regulation, section 3.3b. It says the holder shall be liable for the entire scope of radiation protection with regard to any listed electronic product or premise for which he holds a license. So this simply means that if we give you a license to operate a machine or to install a machine, the radiation protection of that is concerned in that machine or that practice or anything is the responsibility of a license holder. So I'll give you an example. If a license holder is the hospital is responsible to make sure that any radiation protection requirements are met because they have the license, and the regulator will only come to inspect and check if those things are in place that's supposed to be in place to ensure radiation protection. So there's a misconception that this is now our problem to protect the people. It's our duty to make sure that people are protected by enforcing the holder to do so. So so I mean, if the holder cannot provide enough convincing evidence that they are able to protect, we have the right not to issue the license. If we've issued the license, we have the right to revoke that license. I think those things Mr. Mahlangu will talk more about them later on. So this is just for everybody to know that the responsibility. So if you are an independent, or if you are a private radiographer or a private practitioner, you must know that once the license is under your name, you are responsible for the radiation protection that comes with that machine. Some of the section, again, as I mentioned, the monitoring of radiation workers is very important, as we don't want anybody to be exposed to radiation, but unfortunately, working in close proximity means there is a possibility of exposure. So with that, then the regulation requires that every radiation worker must be monitored, and this monitoring must be done using a personal monitoring service. So currently, there are 2 approved monitoring services. So if you check in some of the guidelines, we've listed those 2 monitoring services that are approved by SAHPRA to be providing this service. So in simple terms, this is the service where you receive your TLD badges, and then it allows you to be monitored for every 28 days. So there's those limits that are applicable to radiation workers, the public, and we don't have medical exposure to those limits. So when it comes to the public, the simple way to understand the dose limit is just to say 1 millisieverts per annum. A member of the public mustn't exceed that dose limit. And then for a radiation worker, we're saying it's 20 millisieverts per annum, and then not more than 100 millisieverts over a period of 5 years. So meaning every year, in any given year, we should not receive 50 millisieverts. So it's important to understand this because sometimes when there's an exposure, a person gets a 10 millisieverts, then they want us to write them a retirement letter to say they can't work anymore because they've received 10 millisieverts in a month. So we need to understand the dose limits in its entire context, that it's 20 millisieverts per annum, but should the exposure be there, it should not be more than 50 millisieverts in any 1 year. And then over 5 years, it should not be more than 100 millisieverts. So the monitoring services, which I spoke about, every time when there is an exposure to those dosimeters, immediately they let us know, and then we start the investigation of where the dose comes from, and the possibility of it being a dose that maybe resulted in negligence or whatever the case might be. So we do receive the notifications from the dosimeter services to tell us when any radiation worker is being exposed. And then, but it's always your responsibility. Now it goes back to the holder when we said the holder is responsible for radiation protection, meaning once we have the exposure, we go back to the holder and say, please tell us why was this person exposed at your premises, since you are responsible for radiation protection. So then we take the information from there, and then sometimes if there's recommendation, then we make recommendation, and if there's a need for enforcement, then we do as the inspectors will do. So when it comes to patients, so the regulation touches on patients as well. As I mentioned, patients, we don't have those limits, but we always want the for diagnostic purposes and therapeutic purposes, we want the dose to be kept as at lowest possible values. So you guys, I know you've learned a lot, so you will know this is related to the ALARA principle. So the regulations is giving us the ALARA principle in this section, so that we know that if we want to image a patient, CT scan a patient for the abdomen, there's no need for you to start from the head while you are in your area of interest is just the abdomen. So that's the optimization to ensure that you give as low as possible radiation to the patient. It also gives provision to underage persons. So special precaution must be taken if any treatment will be done to anyone that is under 18 years, and also to pregnant women and so forth. So that is why sometimes in certain machines, we always ask that there must be a consent by the patient, that they indicate if they are not pregnant and things like that. So all of those things we're taking them from the regulation to ensure that we now protect the unborn in a way. Okay, so as I mentioned, regulation 1302 will list for us all the machines that are all the instruments that are supposed to be regulated. But just so you know, every machine that is used in the country, it must be licensed for import, and meaning all the machines that are listed in the regulation 1302 must be licensed for import. So, and we do not accept, or we do not license machines that are secondhand in another country and they're coming to this country, unless they are fully refurbished. Fully refurbished meaning the manufacturer of the equipment will have to certify that machine as fully refurbished. So we get a lot of people saying, no, there's a X-ray machine in Canada, they don't want it anymore, they want to donate it to me. Unfortunately, we've been strict about that. type of equipment, the equipment must go through the refurbishment process first before it comes here. So otherwise, machines that are imported illegally or machines that are bought online and things like that, if they manage to get into the country and we find it, we confiscate them, because any machine that is used must go through this process. So this is the application form that you will need. Some of the attachments that you will have to accompany your application. So this will be your application to import any devices that is listed under 1302. So Mr. Colbert will know more about that, as it's his area of expertise. So in a nutshell, in terms of the electronic generators that produces ionizing radiation that are listed on 1302, they include diagnostic X-ray units, therapeutic X-ray units, and then you get the X-rays that we use for research, industrial, VETs, and other things. Then you get electron generators. Then you get your heavy particle accelerators, your cyclotrons and stuff. Then you get your neutron generators. So these are all the categories that we will then have to license to use once the license to import has been obtained. So now we're going to dive into the licensing process. This is the process on the side of use. So this probably is the side that you guys will be more familiar with, but we'll try to clarify certain things. So again, taking from the regulation 1332, when we issue a license to use, it's already giving you a license for the premise, meaning if you look at your license, you'll have your address, and then where the machine is listed on the license, that machine will have an address as well. That tells us exactly where the machine is located. So that means we are licensing the product with the premise. You'll notice sometimes we ask you for the layout, we ask you for the room design and things like that. That is because we want to certify this part of the regulation where we have to license the premise. So when we issue the license, usually we give it to a specific institution. So if it's an institution, it must be a medical institution, a dental practice, radiology practice, oncology practice. So we always want to know what type of institutions are we giving the license. For an example, we can't give a dental practice a CT scan, if I'm making sense. So depending on what you're looking to license, we need to know what is your practice. So we can also issue a license to specific persons. That includes radiographers, radiologists, oncologists, dentists, veterinaries, and I think chiropractors. So when we issue a license for a specific premises, such as clinic, bunkers, industrial sites, these premises we do pre-inspections before the machine is used in this type of premises. In other premises, we technically don't do it. We do it indirectly, which I will explain as time goes on how we do it. But for this one specifically, we do go and do the inspection before we issue the license to use those premises. Okay, so for anyone to be able to send us an application for the installation of an X-ray equipment, it means they would have bought the machine from someone who is licensed to import. And in the license to import, there's a condition 3. So this is the condition 3 on the license to import. So I'll give you an example I'll use Philips as an example. They will have an import license that has condition 3. Condition 3 tells them that when as a dealer, they must submit the appropriate form to SAHPRA, which we used to call it the RC dealer. That shows their equipment and the components that they want to sell, or they want to purchase for you. And then accompanying that, there will be an RC03 or RC011, and that's when it's therapy equipment. So RC10 will be for dental X-ray. So the dealer, if it's a new machine, they are involved in this process simply because condition 3 tells them that they need to report every sale they are making. And this process is a process that ensures efficiency on our side to say, if we know when the machine moves from Philips to the user, then we will be able to license that user at that particular time as they are purchasing the machine. Again, because the Act says you cannot sell or use that machine without a license. So meaning the dealer cannot give you the machine and hope and pray that one day you'll get a license. So the license is done in the beginning of the process. Again, from the condition, it is emphasized that the dealer cannot deliver or install any unit or component until we give you the may install. So these are conditioned only on the import license. So as a user, you don't really have this information at that time. You'll only see the condition that is attached in your specific license. Hence, when we found a machine installed or delivered or whatever the case might be, most of the time the person that is held accountable is the dealer, because this is in their license condition. So, but again, it's good for you guys to know so that they cannot lie to you and convince you otherwise to say, no, we'll just install, the license will come. SAHPRA is very slow. What are stories? Those are the type of stories that they normally tell you guys so that you accept the machine. Technically, you should not accept the machine until all the right licenses are in place. Okay, so these are some of the forms that you will find in case a machine is a second-hand machine, meaning the machine is used in one hospital or it's used in one clinic and then it needs to move to another clinic. So again, we need to be informed when the machine is changing premise or is changing ownership. We need to be informed. So the form that you will use is what you guys know as the RC02. Since I arrived at SAHPRA, I decided to give it a new name. We'll learn this name as we go along. At some point, we'll stop using the RC02 and use the new SAHPRA names. So the one to apply for a license to use is called RC01. So this is very important. When you want to move a machine, when you own the machine, Lazola, please mute somebody there. When you want to move a machine and you own the machine, the form you need to give us is RC02, and the person you are moving the machine, they need to give us RC01. We prefer these forms to come together. It makes the process easy on our side. Now that we know, we remove this machine and we add it to this person. If we get it as one form, if we get the form to dispose, then it means we can't dispose without finalizing where the machine must go. So the process hangs up at that point, and that's where we then get a lot of queries now, people not knowing what's happening. Or we received the one form to use, but then we don't know if the owner of the equipment is disposing to you. So unless the form comes together, then it makes the process easy. And then the change of responsible person it's RC05. Again, this it's a requirement that when you as a responsible person leaves the position or the post, you need to inform us, and then the license holder then will need to appoint another responsible person. As long as we don't know that you are no longer a responsible person, then the responsibility is still yours, unfortunately. So what happens is that, I think I didn't touch on that when we summarizing the regulation. So the regulation, after that sentence that says the license holder is responsible for radiation protection, and then I made an example that if it's a hospital, it means the CEO or the management is responsible for radiation protection, but they know nothing about radiation, so they employ us, meaning medical physicists or radiographers or radiologists, and then they appoint one of those people to be a responsible person. So that responsible person, it means they are doing the work on behalf of the license holder, the radiation protection work. So that's why it's very important when you decide that you were on the license as a responsible person, but now you get a better job somewhere, you need to inform the regulator, because your license holder will take years to tell us that you are no longer there. But in that period, if anything happens and there's an inspection, your name will come up because our system will still have you as the name. So it's always important to know where you are a responsible person and what is required to a responsible person. So in this form, all the minimum requirements that we want to see a responsible person do is listed. But obviously, you guys are educated in this field, so you will know what to do in many cases as a responsible person. So we do have a situation where a machine is stored or archived, and then you want to reactivate it. So there's a form for that as well. Again, to store the machine, you need to send us the RC02, and then to reactivate it, you need to send the RC07. This happened quite a lot when we try to license a new machine, and we find that we have a machine that is non-compliant, and then we are told that no, this machine has been working 5 years. We don't know. We don't work. I mean, we don't work in that hospital. We do not know that the machine doesn't work for the next 5 years, for the last 5 years. If the machine didn't work or doesn't work, whatever the case might be, you can give us this form to tell us to store this machine. By storing this machine, it means for that period, we will not require annual QC for that machine. But as soon as you reactivate it, then we will require what you call it, acceptance test, because the machine has been in storage now. It's back to clinical use. So what normally happens, excuse me, other people then will want to put this machine on storage on our side, but they continue using it. That is a transgression, and Mr. Mahlangu doesn't like that, because the machine will be marked as stored, meaning when the inspection happens, it must be found stored. And usually, when we find it stored, we can even sell it to make sure that nobody uses it until we receive the reactivate form. So I'll just show you a little bit of the workflow that happens when we receive the RC dealer. So the RC dealer, again, is when it's only for the new equipment. Again, I mentioned that the form comes from your dealer, the person you're buying from the machine from, the company you're buying the machine from. So what they will do, they will give us the RC dealer. So the RC dealer, the first page will have the information of the dealer, and then the next few pages is the information of the user. So make sure that whatever they put there as the equipment and everything, that's what you've ordered from them. Because once we license it and we license it incorrectly, it becomes complex to modify or to change. So what we check now, my colleagues will do the review. There's a lot of things we check. and we check both sides, the side of the dealer, the side of the user. If everything is correct, we either issue a may install or may not install. If we issue a may not install, the may not install will come with reasons. This is a requirement from the Act for us to give you the specific reason why we saying we may not install. Then this information is shared with the dealer and the applicant. So sometimes the applicant will call us and say, yeah, they don't know about this, but the dealer. So we send this information to both of them, and it's between the two of them, the two of them to fix the problem and then send the form back to us. Then if it's compliant, we send a may install, and then then once the installation has happened, then the acceptance test will be done, and then we will get the inspection body report. And then the inspection body report comes with the electronic submission, and then we then update the database, and then you can use the machine. If a machine is secondhand, then we want, as I mentioned, we want two forms, the RC02 and the RC01. So first, if a machine is just being disposed, meaning it doesn't go to anyone, it's condemned, we use the same form to indicate that is the machine will be dismantled, and then we update the database accordingly. I think there's a guideline that tells us about the disposal of X-ray equipment, because this the tube contains beryllium, which is a group 1 hazardous substance. So at the moment, we don't insist on getting a disposal certificate, but seeing how people are disposing in future, we might request the proof after the disposal that the equipment has been disposed and by the accredited company. So if you don't know how the disposal work, and the SAHPRA website radiation control guidelines, you look for disposal of X-ray equipment. The details are there on how we dispose them. And then when it's sold or transferred, most of the time there's a business side of this between the people who are transferring. So the money exchanges hand, and nobody then wants to do the process. Again, when that comes and we find these things, we don't know. We're not part of that. All we want to check is, you as a current holder, have you done what you're supposed to do to make sure that the machine is no longer in your name? And the new holder, again, if the new holder trying to get the machine doesn't qualify, we'll tell them that you are not qualifying. So we always prefer that people start with the regulator before they sell each other machines, because once you sell the machine and then the other person cannot register the machine, then the machine, it becomes chaos for you guys. And unfortunately, we cannot help, because we always want to make sure that a machine is used by appropriate people. So it does happen that you sell a machine to a wrong person, and then that person cannot get the license. Then the machine cannot be licensed. And as long as the machine cannot be licensed to somebody else, it remains with the current user. So it becomes the responsibility of the person that is currently licensed. So we can't, because you send us the RC02 for transfer, we can't say you are no longer responsible. As long as the application is rejected, we are still responsible for the machine. Right, so this will be the process. So again, when we send you a may not install, we send this form to both of the people who, the one that wants to use the machine and the one that is selling the machine. And then when everything is fine, we send an acceptance letter. And then once the acceptance tests are done, we then update the database using the electronic submission, and then we issue the license to use. Yeah. So So that would be the process in terms of the second hand. So I'm gonna just quickly answer the two questions. Okay, somebody says they lost me. Can you guys hear me?
Yes,
Yes,
no,
yes,
I
we
think
can.
it was earlier meeting. I mean, earlier message.
Oh, okay, all right. Sorry. I didn't notice any disconnection, but I want to answer the two questions on the chat before I carry on. The first one says, in terms of discarding machines through auctions, what are the process that needs to be followed specifically with SAHPRA? We do not have this process of auctions, and only this year I recently found out about this is happening. So the machine, the person that owns the machine, because the auction normally, as I understand it, it happens after a person has been liquidated or they what you call that thing, they repossess the machine or things like that. So the company that is auctioning has no idea what is happening. We are still holding the person that owns the machine responsible to tell us what's going on with the machine. So if you buy the machine in auction and then later on you want us to license to you, you still need to find you still need to get hold of the old licensed person to give you the RC02 to allow you to have the machine. Without that, unfortunately, we can't license that machine. So again, this is another process where we only find out after somebody has bought this machine from auction. Whereas while the person who owned the machine haven't reached out to us to tell us what's happening with the machine. Again, this becomes a problem. We still have a right to go and sell that machine once we find out it was auction and now it's lingering somewhere. We can go and sell that machine. Unfortunately, just make sure that before you buy that machine on auction, you know who the current licensed person and the person is willing to assist you with the licensing. So for now, we don't have any assistant or process to assist with that. The other question is how do GPs who have XA units in their private practice obtain their licenses? Okay, since 1998, we don't give GPs licenses. I don't know if it's correct, 98 or around that time. GPs, but unfortunately, there are GPs who had licenses before that time. And according to the Act, if someone had a license before, we cannot revoke that license based on the new changes that we've made. So the old GPs who have the machines, the only requirement is that they must employ a radiographer to work on those practices. But going forward from that point, we do not issue any GPs a license as a license holder of a machine. So some of the GPs then they use radiographers to apply for them and things like that, which is fine because radiographers they qualify to have a license of an X-ray machine. What blocks a user from being registered as a holder? There are various things that we look at. Some people, okay, so I will assume this is for an individual. So if you are not the right qualified persons that I listed before, let me see. So if you don't, if you're not any of this based on the practice that you want, we might not list give you the machine. Again, if you already have a license, but your current license is non-compliant, we might not give you a machine. For radiographers, sometimes you also want them to be listed at HPCSA as private practice and things like that. So as long as we don't issue you a license, we tell you what the reasons are. And the reason why we do that is to assist you to do what you're supposed to do so that we can then reevaluate your application. Okay. In in Limpopo, we have a lot of units to dispose. SAHPRA advisors, we can sell this as scrap metal. Is this allowed? I'm not sure who advised that at SAHPRA to sell them as scrap metal, but maybe Mr. Mahlangu can advise there. But in terms of the disposal, our biggest concern is the generator, the tube, because the tube is the one that, as I mentioned, is it contains beryllium, and beryllium is a group 1 hazardous substance. So in our guideline, we don't have this provision that you can sell this to scrap metal. But what we're saying is that when you dispose the tube, you need to make sure it's disposed at the correct way. So if we auction the machine for scraps and still holding the X-ray tube, how do we dispose it? Please, in terms of disposal, refer to the guideline. The guideline is on the website. What you need to do is to get a facility that is correctly accredited. So the accreditation for disposal of this unit is there on the guideline. How do you know that the facility is accredited? So you can't just throw it away. It must be disposed through those facilities. Does the system allow one to be responsible persons for different institutions? Yeah, this is probably something that we can also discuss later on. But the system will allow that. But during our evaluation or our review, we also use common sense to say, I mean, you can't be in Limpopo and you're responsible for machines in 15 different hospitals or whatever. At the moment, we don't have a clear criteria, but we always ask the user how they're going to manage to be responsible for all the units. And based on how they tell us, on what they say, then we can decide if they are able to do what they say. The Act clearly states that we will issue the license when we know that the person can take care of the machine and all the related activities. So that's what we use as a rejection should we see that the responsible person will not be able to take care of all the responsibilities. But this is where the experience of our review team comes in, because also looking into the inspection problems and things like that, then we use all of those things to decide how to approve or not to approve. What happens to those GPs with license who do not hire radiographers to operate the machines to operate? So we give them what action can be taken against them. If there is such, we sell those machines and then we report them to HPCSA. This becomes easy for us because we can't revoke their license, but through this process, then we are able to revoke their license because now they are violating a condition. The question is for a dentist in public who could not be registered as a license holder. So dentists, if they're applying for a dental equipment, they should be able to get registered as a responsible person and as a license holder. The only problem is when the equipment is bought through Take a Lot and things like that. We don't license those equipment. So you have to buy the equipment through the correct procedures, unless if the dentist was flagged before as a transgressor of the machine, the transgressor of the act, I mean. But usually dentists, they do get the license. Of course, for the practice that is related to dentistry. So if you apply for a CT scan as a dentist or any other thing that has nothing to do with dentists, then we might reject that. Okay. How long will it take for the equipment to be considered non-compliant with the reference to 12-month cycle of annual QC? I don't know if my colleagues will be mad at me. It takes a month or two. The system is designed to give you a grace period, which we don't say, but you won't see it there. But it takes about a month or two for it to reflect that it's non-compliant. What makes it what makes it possible to issue a license for a pen to a dentist? So this goes with the practice, because if the machine is in there, even though the machine is in the radiology department, the practice is of a dental practice. So there must be a dentist involved. It's the same as you find that a private clinic has it's owned by a dentist, but now they want to put a chest X-ray. We want a radiologist to be involved. You understand? So the fact that the machine is installed there, the practice is still required to have a dentist involved. The barrier placed against the licensing of second hand from foreign countries not putting radiographers in need to open practices in the. What was the experience, if any? Okay, so please mute Lazola. Thank you. Yeah, so what happens is this now. There are a lot of machines that comes through this process from foreign countries, and then once you open this, there's the NGOs that brings all the machine. Then you become flooded with machines of low substandard quality and without proper what you call it, support of those machines. So what happens is that you find that you get machines that nobody knows how to use those machines, or nobody knows how to service those machines and things like that. So those machines, they have a lot of problems. And if you allow them to come through that process as secondhand, then they don't come through the dealers, then they come through NGOs, and yeah, it's a problem. So there's a lot of those machines. We found that in the early 90s, they were just being dumped, and nobody knows where they came from. Nobody knows how they got here and what to do with them. So again, that's where the strictness of what should come in the country, meaning when the machine comes as fully refurbished. So we have what we call the post marketing surveillance. So meaning if there's any detected issues from the company that refurbished these machines or the company that created this machine, they're able to communicate to us that, you know, the filter that we put there and we thought it's doing this is no longer doing that, it's not doing this, or after a certain time it must be changed, because so those are post-marketing communication. So meaning this machine as it comes, there's also still an attachment to the supplier to be responsible if any things that have been picked up somewhere else, they are able to communicate it to us, and we have the database, and we are able to communicate it to you guys to say that machine that you have, these are the problems that have been picked up somewhere else. So those machines that come as secondhand and without that backup, usually then we don't have we don't have any knowledge of anything. All right, so the current process that I'm displaying, this is when we want to install a therapeutic device or a high particle accelerator. So I'm gonna quickly run through this because it's part of what we do. So in this case, the forms that we want, they are separated. So this is your RC dealer combined, but for this process, we separate them. And then we get a lot of documents in terms of the plans, the radiation protection plan, and all of those things that comes with this process. And then again, same thing, the outcome of review and assessment is may install or may not install. And then once we have a may install, we issue a license with condition 72 that tells them that they must do acceptance test and commissioning. And then once that is done, they call us to do a pre-inspection, pre-licensing inspection. Once we've done the pre-licensing inspection and we are satisfied, we issue a license. So usually after the pre-inspection inspection, if there's anything wrong, we give them time to fix. So I thought it will make this workflow longer for no reason, but we don't normally reject at this stage, but we give them time to fix the problems before we issue the license to use. Okay, so I want to highlight a few things on the application form. This will be your RC dealer form. Things that we really looked at and we want to see them when you get the form. So again, the form, if you are part of the procurement and everything, you need to be alerted and know what is the form, because sometimes we start reviewing your form, we receive your form today, we review it 3 weeks late, and that's where we picked up. And this is not because we are lazy or anything. This is because we receive hundreds and hundreds of these forms. So your form, when you send it today, and next week we tell you, or 2 weeks later we tell you that no, you didn't put this information, whereas you should have seen it before you sent it the form. So it's important to know and understand what the form says and what is required. So one of the things that we need is the dealer must give us their import license number for that specific brand and model of machine that you're buying. And then the serial number is only compulsory for dental and vets. For medical X-ray equipment for now, it's not compulsory because we get it after when we receive the inspection body report. And then we need to know the specification, technical factors. Sometimes this is left blank. I'm not sure why. And then here we need to know which inspection body will come and do the inspection, the acceptance test. So again here, sometimes most of the dealers, they also have inspection body license, so they will put their license there. The form continues. Now, this is more on the user side. The user, we need to know who is the license holder. If it's a hospital, we need the name of the hospital on top before we get the address. If it's an individual or a company, Radiologists Incorporated, whatever, we need that name as clear as possible. So in terms of the contact person here, this is the person from, if it's a hospital, from the management, we need somebody that we can contact when there's issues. I say CEO because CEO becomes the responsible person for the license holder. If it's a hospital, if it's Johannesburg Hospital, when we're saying the license holder, this person will be representing the hospital. But again, they will then hire a responsible person, which we'll see now here in section 9. If your application is for an institution that is already existing in our database, please provide the license number, because sometimes it takes a long time for us to find the license number based on the name that is provided there. But when you give us the license number, it's easy to find this information in our database. Responsible person appointed. Again, as I mentioned, this is the person that will have the appropriate qualification in terms of what we require as a responsible person. This person is the one that we need your HPCC proof to be attached. So some of the people that we accept as responsible person is the radiographer, radiology, medical physicist, and chiropractor. And then also obviously for dentists as well, if it's a dental practice. These are the duties of the responsible person. These are listed on if you don't know them, it's listed on the one of the guidelines, and it's also listed on that form that we call RC005. It has a new name. Just you'll see on the forms on the website. It will say change of responsible person. So these are some of the duties. I won't go through all of them, but making sure that the radiation safety standard is adhered to, and then making sure that QC is performed at the prescribed frequencies. So then there's other things, even any other thing that the hospital requirement, just make sure that people, they don't say they're limited to do this. This is only for us. So if the hospital requires, your employer requests you to do more than this, please don't use this as an excuse and say, we say we must do this. This is the minimum on our side that we expect. Right. So other things, making sure that there is adequate monitoring for all the people, there's protective clothing. Again, some of these things, you don't pay for them. The hospital must pay for them. You just make sure that they are in place. If the hospital is giving you problems in paying any of these things to make sure that the things are done, you are welcome to inform us, to tell us that the hospital doesn't provide protective clothing, meaning you are trying to get this thing in place, but the license holder, which is the hospital, is not providing. You are welcome to tell us, and we will deal with it. So the form towards the end, it talks about the installation in section 14. This is where we want the plan. Please, I don't want handwritten plans anymore. They are very difficult to interpret. There is a guideline for the design of X-ray rooms. So your plan that you give us, we review it based on that guideline. So we need to make sure all the required specification of the walls, the doors, and everything must meet that guideline. So if you're not familiar with that guideline, you can find it on the SAHPRA website. I think it says design of X-ray rooms, etc. So you can use that to familiarize yourself. Again, we talk about radiation monitoring. Then you need to specify which dosimetry service you are using, and this is because now, in the olden days, we used to have one, now we have two, so you need to specify which one you are subscribed to. Okay. With section 14, in terms of installation, we don't require installation for mobile machines, and then for any other machine, we will then require the layout of the machine. Some of the other things that will require, if it's a cath lab, will require an appointment of a medical physicist. If it's a radiotherapy machine, we require a radiotherapy bunker design calculated using the NCRP 151. So for mobile and portable, we don't need the thing. We don't need the diagram. So if you are applying to add a DDR or a CR, also there's no reason for you, as long as the machine you are adding to already exists, there's no need for you to add any plans as well. Okay, so these are the dosimeter services I've talked about, SABS and dosimeter services. So these are SANAS accredited and SAHPRA approved. So they may install that I spoke about in those workflows. Again, it may install means the machine can be delivered, installed, and the acceptance test done. It may not install, doesn't mean we are now enemies. Because when we start discussing they may not install, it sounds as if we are now fighting. We are not fighting. All we're saying is that get certain things in order for us to proceed. And the sooner you get those things in order, the sooner we change the may not install into may install. So at this point, if an application is a rejection, that's a big thing. That's something totally different. So when we send you a may not install, we are not rejecting your application. We are saying, at this point, don't install. These are the issues. fix the issues, then we back to we are about to, then we are back to issue a may install. A may not install is always communicated to the applicant and the dealer. So on your form, the people that are listed on the form, on the application form, these are the people that we normally communicate this information with. Sometimes, even if you are involved, but you are not in the form and you try to call us, sometimes you'll see it to be really a bit difficult to get the information. And this is because of the requirements. I mean, this the SAHPRA requirements to protect your information, and also the POPI Act as well. Okay. So the inspection bodies that are doing your QC, they get accredited by SANAS and approved by SAHPRA. Then they need to do the acceptance test. They need to do your QC. Those are arranged by the responsible person in the practice. And then their responsibility is to make sure that they send those tests to us. Inspection bodies, inspection bodies, they are not SAHPRA middlemen or SAHPRA agents or anything like this. Their duty is to do QC and acceptance test. Once they've done that, if you send them to follow up on your application, to follow up on other things, chances are they will not get that information, because that information is for the license holder. So we tried to make sure that everybody is doing what they're supposed to do. So when they tell you that they will sort these things out for you, chances are they might not win, because if there's pending applications, as long as they confirm that they've sent the test, that's the end of story. Then we go to the next step. We look what is required and what was applied or what was rejected. Then we move from there. Again, this is to protect your information, because information can be misused by other people. So we make sure that your information is safe with us. Okay. So this is just to show you that they don't operate on their own. They operate under our approval and the accreditation from SANAS. So this is an example of your license that you will receive as a license holder or as a responsible person for a for a practice. So you will get the type of machine. It will have a license number. I just removed it. In the middle here, it will have an address, the address that is linked to okay, so this license I showed now, this would be probably for a dental. That's why it's like that. But for an X-ray machine, you'll get the machine, you'll get the premise address in the middle, then you get the condition. So the condition will be a number here, and then the following pages will show you the number and the text that is associated with the number. So that will be the condition. So you always need to know for each machine, it will have different numbers. So then to know the text of that number, then you go in the next page of the license. So this machine says keep installed. If it says keep installed, it means the machine is not yet licensed to use. For it to be licensed to use, it must say keep installed and use. So sometimes we used to give you the QC date here. We'll discuss it some other time, the changes that are coming for that. So I think this is the end of my presentation, and I just want to emphasize that all the guidelines and all the guidelines and all the acts and the forms, they are all available on the SAHPRA website. And then some of the questions that came through in terms of things that may not be correct, we do have a whistleblower thing. If you go to SAHPRA, contact us, you can anonymously tip us off on what you see on the ground happening that you think is not right, or you can simply directly email it to us, and then we'll be glad to help. But But please, if you don't want if you want to keep anonymous, you can use the whistleblower as well. So these are all the links to the forms, the guidelines, and the acts. So I'm gonna, Mr. Colbert, if you allow me, I will quickly in 2 minutes answer some of the questions that I see. I think there are about 3 or 4. We'll still have the discussion. Please, anyone that has more questions, we'll have a full hour to answer some of the questions. Okay. What conditions are required for dental staff to be exempted from wearing dosimeters? Okay, so when you look at the dental license, at the back of the dental license, there's a prescription of the exemption. The exemption, it goes with your workload, and it also goes with the history of exposure. So just check on the condition of your license. The details are there. But in a nutshell, we need the history of exposure, and then we also need the workload, your current workload. So those are the 2 things that we need for the exemption. Okay, how are ultrasound machines imported? So the ultrasound machine falls under non-ionizing radiation medical devices. So again, these machines, they are scheduled under Regulation 1302, and anyone that brings this machine needs to have a license to import them. Mr. Colbert will sign off that license for them. Alina, how often must the letter for appointment of responsible be renewed? As long as the person still works in the practice, there's no reason to renew, madam. It's just that every time when you send an application, for a new machine, you keep on telling us that this person is still the responsible person. So the only thing is that now and again we will, if the person exists on the database, we'll still ask them to send us their HPCSA sometimes, just to make sure that they are keeping their HPCSA updated. We do have access to the database of HPCSA as well. Sometimes we don't ask for it, we confirm it ourselves. But then it also depends on how busy we are. But most of the time, we'll just ask the HPCSA to make sure that the person is still registered and active and at HPCSA. But if the person still works for the practice, there's really no renewal process for responsible person. Is it ethical for inspection body to withhold your annual QA results pending payment? This is a business transaction that we don't get involved with. At the time when we ask for the QA and the QA has expired and you're saying it was done, but there's no payment, we really don't get involved in that discussion. So it's your responsibility to make sure that the payments are done. When it comes to the acceptance test, their license condition says acceptance test must be sent immediately. That's all we said. We didn't talk about payments, nothing. We're just saying, because the reason why we say this is because on the system, the machine is pending approval for use, pending this acceptance test. Hence, we want it immediately. So again, in that case, if it's acceptance test, you can let us know that they are holding it for you. But for annual QA, we might not be able to help. We'll still think your machine is non-compliant, whether we receive the result, as long as we haven't received the results. Okay. I don't know who's AXA. So maybe we can discuss that, Madam Alina, during the discussion hour.
AXA is Auditor General of South Africa.
Oh, okay. All right. Yeah, maybe we can discuss it later on. I will give back to Colbert so that we get to the next presentation. Please keep some of the questions and then we will discuss it. We'll have the full hour to discuss it. Thank you very much. Over to you, sir.
Thank you so much, Mr. Mapope, and thank you a lot for such a comprehensive presentation. I'm handing over now to the next speaker, and our next speaker is Mr. Mahlangu. Over to you, sir.
Thank you so much, Chair. Thank you for the opportunity. I will share my presentation, and then please indicate to me if you can see it. See my presentation?
Yes, we can see your presentation, Mr. Mahlangu.
It's on the presentation mode, I guess. On my side, it shows. Thank you so much. I will just want to go quickly to the overview, and I'll take the opportunity to welcome our guest in this platform, and thank Mr. Mapope for a very wonderful presentation as well. To be frank, stakeholders can actually implement the requirements for licensing and adhere to them. Inspectorate all. But we all know that now and then there will be those people that look the other way and ignore the law. Hence, we find ourselves relevant in most cases. So I'm going to just under overview the points of discussion today. Will start from the mandate of the inspectors down to the fit for purpose, which is our organogram. Mr. Mapope has covered adequately the act that mandates us to do our activities, particularly on the processes of licensing. And the act was so good to a manner that it also has included powers of an inspector. As we all know that any license that is given, there should be enforcement to ensure that compliance is adhered to. So looking at our Hazardous Substances Act, and as amended also in 1992, to make way for the Group 4 hazardous substances. It also deals with, in Section 8, it deals with the appointment of inspectors, and it further elaborate on the powers of inspectors under Section 9, but it doesn't end there. It also covers section that deals with enforcement, which may be in this regard embargo, whereby we hold you down and say we are not doing anything, or we can even revoke, cancel your license. And that will depend on the magnitude of your transgression that may actually result in withdrawing your license permanently or for a specific period. But it also allows inspectors to confiscate seizures and takes any devices that you may have without a license. It could be devices, it could be any hazardous substances that it's in possession of without a license or an authority. But for the sake of this discussion, we're going to limit ourselves to the Group 3 hazardous substances, which is the listed electronic products that we are here to discuss today. But now this act has also looked at further to that, has also looked at preservation of secrecy. Mr. Mapope has actually emphasized that we protect your information. It is used only for the intended purpose, for investigation if needs be, or for processing your documentation. And it ensures that we protect your information at all costs. So because now and then we find ourselves in the process whereby our stakeholders, license holders, refuse to divulge or to give away some of the information. But I want to tell you in this call to say, we ensure that you are protected at all costs. But it doesn't really stop on protecting your information, but it also look at the offenses to a point that those offenses can actually be taken either to prosecution or to penalties, paying fees, which it allows to do that. And we haven't tapped into that aspect as yet. But it's what we are looking at as a regulator to make sure that we can able to generate revenue and also to able to perform our work very well. But further to that, this didn't end with an act itself, but on the regulation that Mr. Mapope has adequately deal with, it also gives powers to the inspectors to come into your premises at any time, because people feel that we need to make appointment at all times. We'll deal with that, but it allows inspectors to come through to your premises at any given time and demand and request information from you, depending on what is the situation. This regulation, as we have already known, that it deals mostly with control of electronic products. So I'm not going to discuss the Group 4 hazardous substances. I'll move on to the next slide. In this regard, we just want to give an overview to the colleagues in this call to say you need to understand the work that we are carrying out behind scene before we come to you. So there's a lot of planning involved within the space of executing the inspection. So we plan on a monthly basis, and that plan, which start off with the inspector, it will be forwarded to the line manager for discussion. And if the plan passes the evaluation criteria, then definitely the plan will be forwarded to the deputy manager for approval. But if it doesn't, it will go back to the inspector to do it and polish it if necessary. Once the plan is approved, now it is awaiting for execution. So approved plan now will then be forwarded to the inspectors when it's approved by the deputy manager, and it will also be shared with the admin screeners. The admin screeners, then this will be the people that you will often get a notification of inspection from through the email and the follow-up by a phone call. So now, with regards to the plan inspections, we'll definitely get hold of you to say, look, because we are nice, we are coming, and this is what we require from you. This is the time that will be coming on this specific day. Please prepare this for us. But with an unannounced inspection, there's no appointment that is needed, because that inspection could be triggered by some few things that will want to nip you on. So we'll come through and then we'll engage with you in a very civil way, and try to present ourselves to you and the reasons why we are here. And if needs be, we can also have a quick meeting with the senior manager so that we can explain and then deal with the issue. But now once that is finalized, now there's a traveling arrangement that needs to be done, and it's where the cost and money is needed, whereby some inspectors needs to sleep over. I mean, you cannot expect someone to drive for more than 300 kilometers and come back on the same day. So with regards to the traveling that might be more than an hour, 2 hours, then we encourage that inspectors must sleep over and then perform their work adequately without any treasure. So we then move on. After that, we then can move on to trying to move my things are a bit okay. Now then, while this has been planned and it's ready for execution, now there's a lot of work that needs to be done as well prior to execute that on-site inspection. We need to examine inspection reports that could have emanated from the previous inspections, and then we print what we so-called a duplicate of your license that give details what you have on your license, which we refer to it as an advice form. Then we further look at review your license, looking at what you have on your license, the serial numbers, and what is missing, and who are the responsible people on that license. And then we note the status of allegations or incidents that were leveled against you. And then if it happens that this is there's an incident that has been reported to us, then we'll have to arrange for an unannounced visit. Then, but we also analyze a response to the previous non-compliance. When we say we analyze the response to the previous non-compliance, we look at, after we have given you a report with the findings, did you give us feedback on the mitigation strategies that you will do, or if things that they just needs to be resolved, have you probably do what is required? Let's say it may happen that one of your responsible person left, and then when we find that, did you appoint the other one in the interim after we have inspected you? So those things, we look at them. We identify any unresolved issues from the previous inspections, because sometimes there will be those unresolved issues that were not. So this will be our point of departure. When we start the inspection, we'll come and ask you, what have you done about this, which was given as a finding on the previous inspection. Then we can plan our inspection and move on. So now on-site inspection, now we are on an inspection site, just to give you a hint, and so that you don't feel as if you are, being treated unfairly. So on the arrival, we try by all means to be on time, but what is very important, we conduct an entrance briefing. So we engage you, and now we present ourselves to you formally, and then we also tell you the purpose of our inspection and how the inspection is going to be conducted. And then we entertain your frustrations. At that point, it's an engagement whereby you can even tell us in advance to say, look, we are struggling to do this, so that when we start our inspection, some of the issues we already have sight of them. Then we can do the tour to the premises. Now we encourage that by all means we must have the responsible person assisting us and guiding us. It could be the RPO, or you could be the license holders, some of the managers, or the hospital directors. They want to take in charge of these things, because audits are sometimes can go the other way, and if you are not involved, you might be in trouble. So we encourage anyone who has knowledge and who can able to give answers to accompany us through the process. So now, in that process of doing an inspection, we look at the source inventory. I know some of the people on this call might be having a combination of Group 3 and Group 4 authorities, particularly in the radiotherapy space. So when you say source inventory, you might have such, but maybe most of you here you might not have. But now this also applies that, because we'll go to all the machines that you have. and ensure that the serial numbers, they're correlating, the generators numbers are correlating, the unit serial numbers are correlating. And then where is necessary, we'll also do the area surveys, to protect you, to ensure that your premises are still adequately enough shielded to protect the workers. And then we'll do, in that process, we do also radiation safety to ensure that where necessary, the public is being warned to say this is a radiation area. Then during radiation safety, we look at your radiation warning signs. We look at the information that needs to be there in terms of emergency, who to contact. I know people have been resistant to say, no, we can't put our numbers there, it's private and so on and so on. But it's very helpful that we have a dedicated number that will be at the entrance of the premises in a case that there is any disastrous event happening. It could be fire, it could be floods or so on. And then we now need the first line responders to come in and assist in that space. When they find that there is radiation warning signs, they don't come close to that place. But it's become relevant and very easy for them to pick a phone and call whoever is responsible to guide them where the source is, where is the hot areas that we don't need to come close, or we need to be prepared for what. So that is very important. And also we look at the radiation protection aspect. Radiation protection aspect, it goes with some areas you come there was an electronic door that was working to shield the room when the beam is on. And now that door is no longer functional. The motor is down, or the door is always open when they are doing their scans. We look into those things, that are those things still functional, and we raise them, and we want them to be fixed because they are very important. We also review your records, which is very important. It may come during the entrance briefing as well, whereby when normally we do entrance briefing, in some other practices, we find that they already have their files on the table. And during this process, we ensure that your SABS records are fine. Your pre-employment records are also in order. And we look at all aspects to ensure that you never had any notification of overexposure in your records, SABS, or it could be dosimeter services. It depends which one we are using. So we go through that. We make sure that your equipment, individual records are also in order. Your maintenance service schedules are adhered to. You've got records that you are doing maintenance, you are doing QA and QC on your units. So this comes during this process. Now, having done that, then we go to a point where we'll now, if we are happy with this, now we go back to the same room, and then we give what we refer to as an exit briefing, where inspectors informs the authority holder. We want to have an authority holder there. Authority holder normally are the CEO of the hospitals, encourage even the unit managers to be part of this exit briefing, where we preliminarily give you the findings. Though we're still going to document them and send a report to you, but we expect you to know them so that you don't get shocked. So now, with regards to those findings or non-compliance, one may refer to, we classify them into minor or major. Should it happen that you have a major one, I'll start with the worst, then we take action on the spot. We really don't dilly-dally about this one. If the unit has to be sealed, I'm sorry, we'll have to seal it. But remember, our approach, and I always say this, our approach is to assist you to comply. We're not there to police. So really there's no need for a brownie envelope or for a cold drink. Our inspectors are there to assist you to comply. But in the event that this might be imposing danger to the patients, or to the people, to the member of public. We really don't want to withhold this and wait for the big disaster. So we ensure that this one, we stop it, and then we assist you now within the engagement if a annual QA is required, and giving the unsealed letters to the inspection bodies to come and do the annual QA and so on. But in the case of minor non-compliance, then issue that compliance directive to say, please, within this specific date, so that these things are sorted out. What is that date? Normally after inspection, because that's also getting to be a challenge now and then. 3 days later now, we get an email coming from the senior manager that so-and-so is expecting the report, and the report is not yet given after the audit. Just to highlight to you that our turnaround time for reports is 30 working days, which translates to 6 weeks. So yeah, it might look like it's very long, but there's a lot involved. Because when we see them for an hour or 2 with you, they might be having another 3 in that day, expected to go out for 10 days in a month. So it's very hectic, really, it's very hectic. So we give ourselves achievable targets of 30 working days to give you a report. And once the report is delivered to you, you still have that 30 days pending to get all those findings corrected. But failure to do that, then we get to the next step, which we'll discuss it under enforcement processes. But now this is what I was just discussing with you. The 30 working days comes in here to say, ensure that you follow up on all the non-compliances that was given to you. And it happens that there's no action taken after the 30 working days. Hence, I'm saying enforcement starts. I've just put the levy of fines in red here because it's something that we are working on as SAHPRA, and it shouldn't shock you when you get a request for public participation during our fee structure. And now, moving on here, I've already touched base on this. Then there comes now, the section that we don't derive any joy in doing it. Particularly, we consider so many things. I mean, our patient lives are at stakes, but you have an obligation to ensure that you adhere to the conditions given to your license. And then if you don't respect those conditions, which their objectives is to ensure that the patients are safe, then there's no point for you to trust with our patients who are vulnerable at that stage. So we make sure that in this process, we don't blink. We come forcefully to you when you don't comply. So if compliance report has been received, and then assessment is done, and then this is after we have actually issued you with an inspection report, and then we look at the compliance report that you have sent to us. We assess it, and if it's acceptable, then we update our database. It may be that QA has been done, the new responsible person has been appointed, or the issue that we discuss of the door that is no longer functional has been addressed. So then we ensure that we close it, that particular. But in the event whereby we are now still being ignored, then the file now will be referred back to the inspector now by the admin screeners to ensure that these are indeed enforced. And then response sent, initial report attached to say to you, look, I've given you a report and it's after 30 days, and then we haven't responded to us. What is the status? Then if now there's no any response, then we now start imposing enforcement to you. And that on its own, we sit down as a team and look at it, depending on the magnitude of the transgression on you. And regulators decide to prosecute. Regulators has the power that is invested on the act itself, that we can take this to the court. And maybe I need to highlight that we have a very big support from the Hawks as well. All these transgressions, they fall under the priority priority. There's actually a unit within the Hawks that deals with these transgressions that related to radiological and nuclear material. So so we have a very big support. If you resist, sometimes we don't want to get to that stage, but we have the abilities and capabilities to able to bring in the law enforcement agencies to deal with matters that are beyond our powers as the inspectors. So now, just to give you an overview, as we were talking about the 30 working days, turnaround times of the reports and so on, inspectorate within the radiation control unit is responsible to cover the entire country, South Africa at large. And then for the sake of ease, this is not political demarcation, but this is for us to able to, to allocate our resources of inspectorate. So we've got 3 regions which is demarcated according to the red line. And you may also see that this red line crosses within the Eastern Cape. So part of the Eastern Cape is covered by Western region or Cape Town office. And then the bulk of it, the entire, the bigger chunk of it is covered by the Durban office. So we've got 3 offices for executing of inspections activities, which is the Cape Town office, the Pretoria office, and the Durban office. And in Cape Town on its own, we have 2 inspectors as it stands, and 1 admin screeners. And then we in Pretoria, which has a very huge number of license holders, who all know that it's a very congested province. So we've got 4 inspectors at this stage, and we've got 1 senior admin screeners and 2 admin screeners. The assistant manager post is still vacant. And then in Durban, then we've got 2 inspectors. Admin screeners post is vacant, as well as the assistant manager's post is vacant. Fast forward to that, then we, for the ease of able to execute our work, we have also broken down those regions into areas now. Pretoria has about 5. Pretoria office is about 5 regions. I think you will observe now we're speaking to, let's say, Mpumalanga and the Northwest. When you look at your licenses, they will have, let's say in Northwest, they'll have 12/ number that indicates the area that you are in according to this demarcation here. As well as Mpumalanga, you may notice that there's 14/ something on your census numbers that you receive to us. At this stage, as much as I've already indicated the extensive of work that we have to do, it doesn't really end there, but we're looking at covering about 13,819 license holders, which are premises with different number of units. And then they're actually broken down into 58 classifications. Why classifications are important? Because that actually determines the frequency of inspection for us. If you look at here, dental, this is the suggested frequencies from the IAA Tech Doc 1529. But we are using this as our reference, but we really don't follow it to the T. For now, we used to inspect dental premises every 6 years, but we have actually noted the inconsistency in terms of how things are done there. In dental, you are expected to do your annual QA every 3 years. And that period of 6 years was very long that we end up losing touch with what is happening. So we are trying hard based on the capacity to actually inspect dental premises every 3 years. And then we'll notice that the high risk one, radiotherapy, it will be every year. And then also in terms of X-rays, it also depends. If you look at the one that deals with conventional X-ray, like your cath labs, it will be normally every year. And then the other ones will be between 2 to 3 years frequency. So that is also important. We are not going to see our faces every year, depending on the classification you are falling on. On this one, I just wanted to indicate, I said our organogram at the end, which is fit for purpose. It's our wish list. It's what is been put forward that for us maybe to able to do our work effectively, we'll like to achieve these numbers. And as for now, you can see we are far from these numbers. I mean, Pretoria on its own has 4 inspectors, which would like to have 20. So that's the situation we find ourselves on. Thank you so much.
Oh, thank you, Mr. Mahlangu. Thank you for such a great presentation. Will you maybe, before we start with the formal questions and answers session, maybe have a look at the questions on the charts and deal with those first?
Okay, I'm on the charts now. I'll just see the questions that are related to. Okay, I think the one, all right, let's see, we really need to dispose of units.
That might be Mr.
I think, yeah, it's more related to licensing. What are examples of common on minor? Okay, there's one question. What are the examples of common minor non-compliances findings or inspections? So on this one, yeah, we are noted, Mr. Mokorela. So on these ones, our minor non-compliance will be those ones whereby you didn't update your responsible personnel. Make an example with that, which I've actually mentioned it, and we're not going to close your machine for that, but we're going to request you to update that, because it's very important to our work as inspectors to get hold of you and to able to have engagements with them, the responsible person, if we'll still have to do the follow-up. So we'll ensure that those ones are attended to quickly. And there will also be issues whereby we don't have a radiation warning sign on one of the doors. We are not going to shut the room for that, but we could request that those things needs to be attended to. So the list goes on, but the major transgressions will be the ones that you avoid very pertinent conditions that are in your license that you must ensure that annual QA is done regularly. So those things we really don't go away from. To ensure that and then if it happens that you have a machine that is not licensed on your premises, we're not going to allow that machines to be used. Whatever circumstances are, tender issues and whatever, it is the law that some people, they just apply for the install, and then after that they don't submit acceptance test results, and then they carry on and use the machines for clinical. So in that case, we really ensure that we meet it. I think that one, why in your inspection organogram dominated by a medical physicist? Yeah, it is actually a good one. It's not really per se dominated, but there is an integrated review regulatory services that is conducted by IAA every 5 years to all the countries to look at their readiness in controlling radioactive and nuclear material in their. So among of the recommendation is that you need to have relevant expertise to lead or to be involved in the issue of regulations. And that was one of the recommendations, that medical physicists must be employed. And if you look at the history, medical physicists were not part of the regulation processes in South Africa. But when you look at with the international standards, most of the time there are medical physicists involved, particularly for high risk areas. I mean, look at the cyclotron, licensing of the cyclotron, and doing routine inspections, as well as the therapy. So medical physicists were one of the professions that were indicated that the regulator must ensure that the relevant professions are up the regulation processes. Does non-compliance of dental department in the hospital affect the licensing of radiology department X-rays equipment? Yeah, I will say to you, if the license holder as the hospital fail on one part and then they are good on the other, we have taken a stand that we are not going to say no. This part is fine, and then we leave it as fine. We will ensure that we make sure that, because we're looking at your authorities and licenses under that hospital as one thing. And then I think for me, and maybe the colleagues may assist here who are in licensing, that we cannot look issues in isolation. So holistically look at the approach. You need to balance issues here. You cannot focus on one part. You find that dental units annual QA is not done, but you go to radiology and everything runs smooth under one hospital. Because when we come and do inspection, we don't even look at that who is responsible for dental. We just say they are under this authority holder, and we will be treated as such.
Thank you, Mahlangu.
Thanks so much.
Yeah, let me just announce to the colleagues that the questions and answer session is open. You're welcome to raise up your hands, and we're going to take 5 hands at a time and deal with those questions, and then take another 5. But there are still, I think, 1 or 2 questions on the charts. I think we can move away from the charts and start raising up our hands. Then we'll deal with the questions as they come. I see yes, I see a hand from Shamila. You're noted. We will, of course, deal with the remaining questions on the charts. We won't leave them out. Yeah.
I think, Chair, without there was a hand before I answered.
Oh yes,
questions.
yes,
Yeah.
yes. Makwarela,
But,
yes, yes, correct. Thank you so much, Mr. Mahlangu. Makwarela, do you? Yeah. So it's Shamila. To manage my screen, so I see. Then there is a Hlomane. I think that's all what I see on my side for now. Makwarela, you're welcome to raise your hand again if you still have that question. Probably Mr. Mahlangu have dealt with when he was answering the questions from the chat. All right, over to you, Shamila.
Hello, everybody. I hope you're all well. So my question is, does SAHPRA as a organization have some plan to form some sort of database? Because from in Limpopo province where we are, we struggle sometimes to find where our QA results are. Sometimes the company holds it forever and doesn't submit to SAHPRA. Sometimes SAHPRA is taking their 1 month, and we from the ground are just struggling to find where our QAs are. And when we want to buy new equipment, we get like a shock to say we've got a May install when actually the QA was done. So I was wanting to know if SAHPRA will come up with some form of database where we can actually track our statuses of our QCs and QAs. So if the company, for instance, had submitted, they must be able to put it onto a database. And if SAHPRA is received, it must go onto a database. It's just some kind of idea that I had that could make our lives a bit easier on the ground. Thank you.
Thank you. Yeah, Mr. Mapope, do you want to deal with that question?
Thank you, sir. Yeah, for now, I think it's a bit tricky, this situation. Hence, in the past, we had the licenses indicating your last QC. So, and that process now is no longer possible, where we can print the license anytime for you guys to see your compliance status. Unfortunately, because of the changes that has been put in place internally. But this goes back to the responsibility of the responsible person in the unit, whereby they need to communicate with us. If the tests are done and there's no response or no report, because the inspection bodies, they're supposed to give you a copy of the report and then send us the copy of the report. So if you ask us that question, if we have received the inspection body submission, we are able to tell you that for now. Of course, in future, there are few systems we are busy experimenting now or piloting to see which system can work better, so that we move from the current system where you will have access online to have a view of everything that is in your practice. So that I cannot promise when that will be implemented, because it requires money, and radiation control doesn't generate money. So it looks like we will need to implement the fees first before we can make improvements on that system. So that's where we're at now. So what I will suggest for now is to make sure, as a responsible person, you keep track, you create your own dashboard where you track your, like individual in the clinics, you track your machine spreadsheet, your machine QAs and all of that, and then you know which machine is due when, and in that way it makes it easy, and after each QA, you receive a report. So later on, when you send us something and then there's a thing that we don't have the test, then you can produce those results. So you must always demand the results from the inspection body. But again, as I said, if there's payment issues between you and the inspection body, unfortunately, we are unable to assist in that case. Because it's a business transaction that we are not part of at that point.
Thank you. Thank you so much for answering that question. If it's okay, if I can just ask one more query, please.
Is it a follow-up on this question?
No, it's another question.
Yeah, let's give Hlomane a chance. I think he had his hand up.
Sure.
If you still have question, Hlomane, otherwise we can allow Shamila to throw another question. Hlomane,
Thanks for the opportunity.
No problem.
Yes, I hope I'm unmuted. Can you hear me?
We can hear you.
Okay, thanks. Good day. What I wanted to know, thanks for the presentations, and the information is enlightening. I just wanted to know what is the feasibility of accessing reports from you, be it either for the X-rays that have been sealed. I'm asking specifically in relation to dental X-ray machines. With the report regarding those that have been sealed, I'm in Mpumalanga province. And secondly, if it's possible to get an indication of how many of the facilities do have proper licenses for the X-ray machines. So for those two things, if it's possible to access, or I have to do my own footwork to find out from each facility if there's a license. Number one, and number two, if the X-ray machines are still in working order, the QAs are done, and they are still they are not sealed.
Yeah, I understand your question. I think your question is similar to, almost similar to Shamil, but what I can say, Mr. Hlomane,
it's mine, but it's not me anymore.
I think someone is.
Okay, what I can say, Mr. Hlomane, is that one, our database is containing, I think Mr. Mahlangu shared the stats of the database, and it's growing every day. So there are certain information we are able to extract from that database, and again we extract information for ourselves to be able to create inspection plans and things like that. So the expectation is always been that the responsible persons and the license holders, they need to take responsibility of what they have. But where we can help, where we can assist, we really do assist. And if what you're looking for, we are able to do, we are able to assist you. So I would suggest that while you are doing your footwork and you require certain information, please reach out. Then we'll advise each other how you can get or what we can give and things like that. But I think your idea of doing your footwork, that's what Gauteng has been doing since last year, after a similar meeting like this. So now and again, they send us information, they collecting, because you guys have the inventory. You're supposed to have the inventory of what was purchased, where and how, and things like that, and then take it from there. Who's the responsible persons there? What is this? So it becomes, for us, we need the information as we need it, as we get to the area, those areas, regions, as Mr. Mahlangu said. But to do a what you call it, a retrospective search and to for a specific region, it becomes a little bit difficult. But while you are doing your footwork, while you are trying to create your dashboard or if there's information you require, we are able to, if we are able to assist, we are glad to assist, because if we assist you to maintain compliance, and that's the whole point, that's what Mr. Mahlangu was saying, that's the whole point, we want to assist you to maintain compliance. So we'll be able to assist in that case. Thank you.
Okay, thanks.
I'm talking muted. Shamila, over to you.
Thank you so much for giving me a second opportunity to ask a question. So everyone, what happened last year in Limpopo is we had a lot of units that were wanted to dispose. So I wanted to get a company to just dispose everything in the correct way. And our clinical engineer called and emailed SAHPRA, and we got some response from SAHPRA. They were very helpful in everything. But the conclusion of the matter was that we should just dispose our equipment by completing the form, putting it onto an auction, and then the person who buys it off the auction has to complete the form to say they bought it, and that's the end of the equipment. Because we were very, very confused on how is the correct way to dispose this with the tube, and who can do it, and how can we solve this matter. And I think in Limpopo, we're still quite confused because we have a lot of equipment we want to dispose. So far, what the team that was sat together with the disposal thing came up with, that it should just be disposed through auction. The form should be sent to SAHPRA, and when it gets auctioned, they need to send the other form to SAHPRA to say that now the ownership has changed. Can you please advise me if that was the correct way to do things?
Thank you, Shamil, for that question. I'm not sure who advised the part of auction. It wouldn't be any of my staff members, because that process is not part of our recommendation or part of our guideline. So the guideline is just concerned about, so basically if you have the machine, is scraps, it's metals, what you do with it, it's fine. It's up to you. But the concern with the machine is the tube when it contains beryllium deposits. So, and that, as I mentioned before, that's why we have that guideline. And that guideline indicates that when you dispose, in this case, disposal, it means you are condemning the machine. Then there's no need for anybody else to give us any other form except the disposal form from the user, because we are condemning the machine. So if the only time we want a form is when the machine moves from one hand to another hand, meaning it was used by you and now it's going to be used by somebody else, then we need the two forms. How this change happen, if it happens through what you may call it, if it happens through an auction or not, we don't get involved in that. So we only need to know your machine is moving from you to this person. We cannot now say license an auctioneer and say the machine is moving from you to TWF, who's a company that is auctioning. We will reject it because they don't qualify to have a license for that machine. So the machine must move from the current user to a qualified user. And that's the process we are concerned about. To the auctioneers and whoever that we don't get involved. It was just a suggestion that if it's done through the auction, you must make sure that the two people, the one that's gonna buy and the one that's gonna sell, they would meet at some point to do the licensing. Otherwise, the machine remains licensed to the original license holder. But if the machine is condemned and it's no longer in use. The only thing that you must take care of is the tube, and the tube must be disposed through a accredited. So this accreditation is done by the Department of Environmental. So the details are in that guideline of how do you verify that the person that the disposal company or the disposal agent, they are approved. So they will show you the accreditation from the Department of Environmental Affairs, and then they can then take care of the disposal. So that's the only thing I can advise, but we can also discuss it further if you wish, Shamila. But the issue of auction, disposing through auction, I don't know about that. Thank you.
Thank you so much. We'll discuss it outside of this meeting if I'm still struggling. Thanks so much.
No problem, madam.
Thank you. Thank you, Mr. Mapope. Any other hands? No hands. There might be, yeah.
There's a question on the chat that was not answered. I'm not sure.
Yes,
I don't know,
yes,
Mr. Mahlangu. The question about
there's a couple of them. Yes, sorry.
Okay, the question about whether is a license under a radiograph, a mobile C-arm, currently used by orthopedics in a hospital. Let me stop there before we go. Orthopedics are not allowed to operate the machines, the C-arm, without the radiograph. If that is happening, it's against the regulation. And if it's reported to us, we normally direct it to the license holder, which is the hospital, to intervene and solve this situation. Otherwise, we seal the machine. If they don't, if there are no radiographers to operate this machine during those cases, then the machine must remain sealed. Is it mandatory for medical physicists to be appointed before the same machine can be used for radiological intervention procedures? Medical physicists, the requirement is for, I don't know, I'm not really sure what are those nephrostomy and whatnot, but medical physicists are required when it's a you'll correct me, Mr. Mahlangu, cat labs. So I'm not sure if this is talking to the same thing, but the only time we need medical physics specifically is when there's
for interventional. Yes, you're correct.
For interventional, yeah. Yes. So I don't know if this would be the same. So since it says radiological intervention procedures, but it's, as far as I remember, it's what you call that thing, a cat labs. It's the one that requires a medical physicist. Yeah, Mr. Mahlangu, you can advise if this, but I don't think this one is applicable here.
Yeah, what I wanted to add, Mr. Mapope, is that when we are doing interventional procedures, a medical physicist is required to be in that license. So, but this has been happening, yes, often on the cath lab and other units that do interventional procedures. So I wouldn't know about the C-arm, but that we can look at it if maybe this can be sent to us. We can always refer to our communique as well as our SOPs.
Yeah, okay. Thank you. Yeah, we'll ask the question, the guest. We'll have to confirm, but I don't remember us requiring it for interventional radiology for C-arm. But in general, for cat labs, we insist, interventional for cat lab, we insist on appointing the medical physicist. This one was answered. What is the license requirement for forensic radiographer X-ray machine? Okay, so again, for forensic, we do have a guideline that talks to the licensing of forensic units. So you will be able to find it if you go to the guidelines under radiation control. But in a nutshell, also forensic X-ray equipment are licensed, and just trying to get the right thing here. The issue now that we have, I don't know if it's if this will be related to the question that is asked, but some of this machine that are used for imaging, what you call this thing in the mortuaries, that's where the, yeah, that's where there's a little bit of confusion, which we are working on currently we are working on to clarify that. But obviously we need the input of HPCSA, or HPCSA is also on top of that, because it seems as if there's a confusion. It looks like HPCSA has a requirement that it can only be done by radiographers. I think on our side, we said it can be done by appropriate trained personnel without being specific. So, yeah, we are trying to work out that. But usually the licenses are issued to pathologists, which the assumption was that they are appropriately trained to use those machines. But obviously radiographers, they do get the license. If it's applied under radiographers, they still get the license for forensic as well. Okay.
Yeah, Mr. Mapope, just to add there, what you are referring to is those are low docs units, isn't it?
Yes,
yes, that I use actually for non-medical in the forensic space.
Yes.
All right, thanks.
Thank you. There was a hand from Kulani. Do you have a question? You can go ahead, ask your question.
Chair, just before then, I noted on the chart from Vonani Mkari that he's trying to raise the hand, but with no success. Maybe if he's also available, yeah, he can come through.
Yeah, Mkari, you can come through.
Thank you very much. I don't know if you can hear me.
Yes, very clearly.
Very clearly, okay. No, I had two questions. Maybe first of all, let me appreciate the work that we are doing in terms of controlling the radiation in our country, and I think we are doing a very good work, even though there are some gaps that I believe you are working on them. The first question is the issue of consequences in terms of these responsible persons who allows orthopedic surgeons or anyone in the theater to operate the C-arm. Do you have any specific consequences for them, or you just have that remedial action of going to the license holder to correct, or there is something that can be done that can at least ensure 100% compliance? Then one last thing is the issue of the CT scan. There is an anecdotal data where people are saying a patient cannot wait in front of the door of the CT scan because the radiation is too much, but I believe the walls and the doors are in such a way that they meet the standards to ensure that the dose that can be received by the public does not become that dire. So I wanted to know if there are any regulation to say people may be in that area for how many meters or so. And then one last thing, the issue of the public dose, the 1 milliseverance, how do we measure it, or is just something that we believe we are keeping it to standard? Thank you very much.
Yeah, Apope, Mr. Mahlangu.
Thank you, sir, for your question. I think I captured your second question very well, the city part. With that question, again, back what I said during the presentation, that radiation protection is the responsibility of the license holder, which is translated to the responsible person in the case of an institution. So during the inspection by the inspection board, during the acceptance test, surveys are done to confirm readings around the premises. So as a responsible person, you have access to those readings. You can see for yourself if they are within the limit. So when we check on our side, the surveys around, it depends now if you have control areas or non-control areas. If it's control areas, it means anyone that is there, for example, where you're operating the machine, that's a control area. It means anyone that is in that area is a monitored person. So if you have people standing closer to the door, but that door is not marked as a control area, it means at some point somebody had determined that it's safe to do so. If you don't know, the principal will be allowed to say, okay, people must stay a little bit far, so that they if we don't know what the dose is there, then you can implement that people must move away. But again, these are all the measures that are done by the institution. In our case, again, when we arrive and we found people sitting in that way, the first questions to ask, do we have the readings of the survey around that area? And then from the readings, then we can determine if it is safe for people to be there. If it's not, then we're gonna implement the recommendations. We're gonna give you the recommendations from there. In terms of the public dose, 1 millisievert, this is an international acceptable dose that was given. We don't really measure it, and I think that's the point, that it's given to this level so that there's not need to measure it. But what happens is that when we do the surveys in a CT scan or even in radiotherapy, where there's a public access, we're saying the shielding that must be in that between that the room and the area where there's public access, that shielding must be calculated and also built in such a way that if there's radiation, the radiation in an annual basis must not exceed that amount. So again, this reading is, if you Google it, it's less than annual background readings in most countries. I think us in South Africa, our annual background reading will be about 2 millisieverts or something like that. So this 1 millisievert is taken to that. Is taken in such a way that it's less than the background radiation you are mostly likely to get in the environment in a year. So it's as low as possible. So, but we use it as a guide when we do the surveys and we do the shielding of some of the rooms. Thank you.
Thank you, Chair. Just before I answer the first question about the cardiologist, using the C-arms in the theaters. I just want to dive in onto the last part that Mr. Mapope was explaining about the 1 millisievert, how it will be measured. For radiation workers who are female radiation workers and happen to be pregnant, there is a way to measure the 1 millisievert to ensure that it doesn't exceed this threshold during the period of gestations when so you measure that 1 millisievert to the fetus using the electronic pulse dosimeters. So these are alarm dosimeters, but you must use them together with your SABS badge. Then pregnant radiation worker will ensure that they don't exceed the 1 millisievert during that period. So you put that alarm dosimeter on the trunk just around that area, which is must be equivalent to 2 millisievert extrapolated as 1 millisievert to the fetus. But for conservative purposes, we don't encourage that they must aim for that 2 millisievert on the measuring instrument itself, but we do take account of what Mr. Mapope was saying about the background radiation. So we always somehow aim for a 60% of that dose of 1 millisievert at all costs. And then with regards to the cardiologist, those ones, they happen to just use unqualified operators, either or to drive the C-arms themselves or use anyone. We are trying hard to ensure that we do what we have indicated, that compliance is to the latter. We make sure that once that incident has been reported to us, we do full investigation. But what sometimes might limit us, it's evidence, because sometimes cardiologists, they do these things on odd hours, and they book theaters and operate in those theaters. Sometimes when radiographers are not available on the awkward hours, maybe after hours. So if there is enough evidence to prove that, first, when you come in, we ensure that we take the C-arm away from the theater, delete, and then if there's still resistance, we are working very well with the inspectors from HPSSA. Mr. Mapope has actually indicated to say that when coming to issues of professional ethics and professional conducts, we don't step in there. We allow the HPSSA to play their role. So we report such people to the health professional councils to deal with them if they've actually violated their ethics. Thank you.
Thank you, Mr. Mahlangu. Any other question? Oh, Mapope, you want to come in?
Okay, yeah. While colleagues are still thinking of other questions, I want to answer 2 questions on the chat.
Yeah, there is a background on your side. I'm not sure.
It's not me. Okay.
Okay.
One of the question, or it's a comment, can radiation control please compile QC test procedure manual for different modalities? Madam, this QC test document is available it's available on SAHPRA website. The inspection body, they use it. The expectation is that the practices must also use it. I think maybe in future we can have a session where we deal with this guideline or with this document to clarify what is expected and all of that. But the document does exist. Okay. There's another question, I just missed it now. the machine about a machine that has been removed from license, how long does the institution have for the tube for the machine to be disposed? Is there a time frame? Okay, on this case, I can say now, as I mentioned before, the correct procedure is that after you've disposed of the tube, you're supposed to send us a disposal certificate. But I mean, for the X-ray machine, we haven't requested that for, we are not yet requesting it. That was going to give us an idea how long it took you and everything. So at the moment, we don't have a prescription for that. So we assume that the machine will be disposed as we remove it in our license. The only thing that you must be very careful of is that the machine doesn't go back to clinical use while we marked it as disposed. That could be a transgression of the Act. But at the moment, we don't give you a time frame when to dispose and things like that. And then for X-ray machines, at this point, we don't even ask for the disposal. We only ask for the high risk equipment such as the linear accelerators. Sorry, Alina, I saw your hand. You can come back. Maybe you wanted to follow up on the previous answer.
Oh, yes, thank you, sir. What I mean is it's not the document for the requirements of with respect to the QC test. What I mean is the step-by-step procedures for each test, because currently there is a document for the, I think it's for the analog equipment and the processing, where like they would tell you like for the fork test, this is the method you must follow and how you interpret results. Because what I've observed is most radiographers, especially in digital departments, do not know how to perform some tests, or even for mammo and CTs, they don't have that procedure manual. Sometimes you find that a service provider will compile a manual for you when they deliver equipment, but it's not all the time. So especially radiographers that are in remote areas or so, we really, I mean, they have that problem of not knowing how some of the tests, even for CR units, how to perform some of the tests, because there is not really a standard procedure that they must follow or a manual that they can refer to. Hence, I was requesting that as much as radiation control has that one for the test procedures for film processing and for the collimation tests and the others, can they also develop a manual for some of these other tests for mammo unit, CT scans, and the digital equipment as well, just to make compliance possible in some of the departments?
Okay, I get you. Now, I just want to also maybe indicate that sometimes as a regulator, we are trying to be careful to what level do we interfere on your operations. Now, the time every time we issue a test, what you call it, a test procedure, we issue it based on the knowledge we have and some of the information that we can gather. But now sometimes there's other requirements from the manufacturer of the machine and things like that. Then we end up with a situation where people will only test and do what is required by that manual. So usually we try to. That's why you will see that even that one that you're talking about is very old, and there hasn't been any other test manual that has been developed since. The only thing that I may assist with is to give you reference documents that then you can compile your own test based on that manual document. So basically meaning if you see the tests that are required on the QC document that we have and you don't know how to do it, then you'll get the reference document where you can check. They will detail how to do those tests on those documents. And I think currently we do have references on the same documents that are referencing where these tests are coming from. those are the documents that you will then use to create your own procedure manual, if I may put it that way. So in terms of standardizing it, I will give you an example. In the radiotherapy, then it was the medical physicist that comes together to compile it so that everybody used the standard one. So it's not, they only share it with the regulator. So after they've received the information, what is required and all of that, then they go and find the documents where it is explicit on how do you measure and perform those sections, and then they compile one document to be used by everyone. So that is another option. But for the regulator to do that from scratch, you will never get any other license, because that will keep us busy for the longest time. But we can assist with the process if it's done on the side of the industry or on the side of the clinic. All right. Thank you. Back to you, Chair Colbert.
Thank you. I would like us to complete the questions on the chat before we accept any other hands. We are 10 minutes away.
Chair, maybe
yes.
there's a question here on the chat that I think it was not answered before we skip it. I think it's relevant to your work. Does the license for the equipment such as ultrasound or non-ionizing equipment expire? If so, after how many months must it be renewed?
Yes, thank you so much, Mr. Mashangu. I didn't see that. So the licenses don't necessarily expire, but we do have for non-ionizing devices, we do have the annual submissions to ensure that all the required documents that you submitted when you applied are still in order. For an example, the CE marking for the suppliers, if it has not expired. So we do request the license holders for, we do request them to submit certain information annually of the devices that are listed under their licenses. So there is no specific expiry date on the actual license, but we do follow up annually. We group all the license holders alphabetically, and then we make a follow-up. We ask them to fill up certain forms and also submit certain documents. Also indicate if they are still, for an example, supplying certain devices listed under their licenses. And that's how we handle questions related to expiry for ultrasounds and such devices. I hope the question is dealt with. I don't see it on my side because there's a list of them, so I've been scrolling up and down, so I didn't even see the person who asked it. Was there a hand? I thought I saw the hand coming. No? Yeah, there we go. Mancha, go ahead.
Afternoon. I'm actually the one that asked the question regarding the non-ionizing equipment.
Yes.
So from what you are saying now, it is fair to say that if I'm requesting that document to see that it was approved by radiation control,
yes,
it must be on a yearly basis. I must see the most recent
that's correct.
certificate or
That's
listing
correct.
of that item.
That's correct. That is
okay.
correct.
No, thank you very much.
Chair, just a quick one.
Yeah.
There was a clarity given on the chart regarding the issue of the C-arm being used in the clarity says, just to clarify, the C-arm used in theater for orthopedic surgery is operated by a radiographer, and it is licensed under radiology department with a radiographer as a license holder representative. I don't know if Mr. Mapope you can give clarity to that. You have a C-arm that is used in theater by the orthopedic surgeons, but is licensed under the Department of Radiology, and it is used by the radiographers in theater.
That is the correct procedure. So meaning every time the orthopedic are doing their procedures, the radiographer must be present. So that's the correct procedure. I think the clarity is that they are doing the correct procedure. The only problem, I think, what you were explaining from our experience, Mr. Mahlang, where we found that in certain hospitals there are cases after hours, and there is no radiographer allocated for those cases. Then, in any case, the orthopedic surgery, then they operate the machine on their own. So that's what you were explaining, Mr. Mahlang. But I think the clarity is to say currently that's the correct procedure. Radiographer must be present at all times.
Thank you.
Yeah.
Yeah, the hands are coming thick and fast. Unfortunately, when we are left with few minutes, but let's quickly see if we can attend to them. El-Ghasa, go ahead. Kulani and Mancha, you are noted as well. But yeah, El-Ghasa, over to you.
I'll just give the greetings and everything. I want clarification on this ultrasound, because I know that almost in every hospital, there's an ultrasound that is operated by the doctors, the ultrasound machines that is operated by the doctors, and it's not under, and it's not there on the license. Does it mean that those ultrasound machines are supposed to be on the licenses for that institution or not?
Yeah, no, we didn't cover that portion, but the non-ionizing devices are not licensed for the use at the moment. All right. What we are regulating is the supplier side. So these are the people who will import these devices from abroad and bring them to the country, and that's the process that we manage. So what we are asking you is, once you go out in tender and you want to buy them, part of the requirement you must ask the suppliers for is the SAHPRA's license, because then that would have mean that that particular device, if it's licensed through us, is a legit. Thank you. Kulani, you wanna come in?
He's gone. Mancha is the hand that is
Okay,
standing at the
Mancha, yeah,
moment.
Kulani have been raising the hand, but also not coming in. I think he might have a lot of questions. Mancha, yeah, take over.
Okay, I'm back with the question from Shamila.
Yeah.
So from what I got is that as long as if we are doing the auction route, as long as we handle the tube part as per regulations, do I understand this clearly?
Mr. Mapope?
Yes, madam. You know what I'm trying to run away from is to discuss the auction part. I don't think that comes from SAHPRA. I'm not really sure, madam, where the auction part comes from. So that's why I'm careful on how I answer this question. It looks like you guys, there's an agreement that SAHPRA said you can auction, and if that has happened, we need to discuss who and how and when, because it's not a recommendation that we will give you how to do those things.
Okay.
That's why I'm trying to be careful, because I don't remember having a discussion. I think I had a discussion before in terms of the disposal, but the part of auction today is my first time to hear about it. So yeah, I'm trying to be careful not to not
No,
to
I think
so we can discuss
we'll just
it.
take your
Yeah.
advice to discuss it outside this meeting.
Please, we can do that. Yeah.
Okay, no thanks.
Yeah, but the general process would be I mean, once you've taken care of the tube, the machine can be disposed. So I cannot advise you how, where to auction or where to throw. I cannot advise. Obviously, you need to take care of the environment. You can't just leave it on the street. But I cannot say take it to auction. That's not part of our scope.
Okay, thank you very much, ladies and gentlemen. Yeah, it looks like the questions are many. Similar engagements should happen very regularly. The interest on our processes at SAHPRA, yeah, it's getting attention from you, and that gives us a lot of pleasure. And unfortunately, we have come to an end of this engagement. And I would like to thank you for your attendance. And yeah, we appreciate. I understand we had 2 provinces here, both Limpopo and Mpumalanga, just to confirm. Okay. I've also put in the inquiry email address for radiation control. And Mr. Mapope is indicating that the link to the video will be shared and the presentations too. I think someone asked that. And colleagues, I think, yeah, we end it here, and I'm officially closing the webinar. Thank you very much.
Thank you.
Thank you.
Thank you, everybody. Bye.
Thank you. Bye.
Thank you so much. Bye-bye.